I'm Raquel Perez. I'm a physician scientist, radiologist by training, and currently I'm leading the Radiomics research group here at the Institute of Oncology in Barcelona. I had the privilege to collaborate with the Cancer Core Europe Imaging Task Force since the beginning, when I joined VHIO by late 2017. In the beginning, with some of the projects that were already ongoing, like the harmonization of imaging-derived biomarkers from CT and MRI through all the Cancer Core Europe centers. And then later on, as part of the DART consortium, which is big, comprehensive, and very ambitious project led by Elena Garralda under the umbrella of Cancer Core Europe and funded by the European Commission, and aiming to improve the clinical trial design and accelerate drug development in cancer. And more recently, I've been appointed as the Cancer Core Europe Imaging Task Force new leader, which is a big responsibility, but also an honor and a privilege. And I'm committed to reinforce the projects and the networking that was already established, and hopefully also establish new initiatives and new projects involving imaging biomarkers in cancer. So the overarching objective is to unite some of Europe's leading research group in imaging biomarkers in cancer towards improving cancer research and ultimately cancer patients' care. But obviously we also have a short-term, more specific objective, such as those developed under the DART consortium, aiming to identify and provide tools to select the best patients, the best candidates for immunotherapy. And for those aims, we are establishing new platforms in Europe, like federated learning platforms, to be able to develop AI models without having to share the data, which will potentially overcome some of the legal and ethical issues of data sharing, and also platforms for integrating imaging data with other sources of information, such as those coming from tumor and plasma samples and clinical information as well. And those platforms will potentially not only allow us to achieve the DART aims, but also going beyond and accelerate other Cancer Core Europe research projects. So medical image is a truly powerful tool used in clinical practice every day that allow us to see what's going on in a human body three-dimensionally. So we see all the sites of metastasis, and we can non-invasively track changes in the disease throughout treatment. But it's true that in the past, we were limited in the number of imaging-derived biomarkers that truly help us in daily life. But with the advent of computational analysis and the applications in this field, we are now able to exploit and get the most from the information of medical images, not only in more advanced images such as PET or MRI, but also in images acquired every day in cancer patients, such as computer tomography or CT scans. And that allows us to track cancer throughout treatment, identify differential responses, and also accounting for the spatial resolution of those images, even identify differential responses within a tumor, guide biopsies, and definitely provide tools for our colleagues in the wet labs to identify, for instance, mechanisms of resistance. But these tools are also approaching slowly to the clinic for supporting medical decisions as well, not only for improving how we detect and diagnose cancer, but also to improve how we predict the response to specific treatments and how we assess if the patient is truly benefiting from those treatments, so we can identify at an earlier time point if the patient is progressing to therapy and decide to switch treatment to try to keep the disease under control as long as possible. Initiatives like Cancer Core Europe are of paramount importance to advance in cancer research and improve how we take care of cancer patients. I'm convinced that just by putting together the efforts, expertise, work, and data of multiple centers in Europe and worldwide, we'll be able to advance in this field, to provide new tools, and to combat cancer and provide hope for cancer patients and their families.